My name is Miki Shainovitz. I'm a professor of physiology at Tel Aviv University, and in the past 4.5 years, I serve as a chief scientist in Aerotel Ltd, Israel.
And
Welcome, Dr. Fidler.
thank you. Thank you. I'm Dr. Howard Fidler. I am a doctor of chiropractic, also certified in acupuncture and sports therapy. Been practicing for 18 years now, primarily in Minnesota, and my main specialty is working with elite athletes in sports medicine.
Uh, can you tell me, please, how did you first hear about pulse electromagnetic field therapeutic devices?
Sure. I've always been on the cutting edge of technology. I think you have to be, especially if you're going to work with elite athletes. And as I started seeing new things come out, I learned about PEMF, the benefits of it, and how it can really help not only my athletes but all my patients. And first met Aerotel about a year ago, and was absolutely amazed by the research that I read. But as with everything, I have to put things to the test, and I brought home the technology, started using it on people, and the results have been nothing short of amazing.
Can you describe a little bit more what was the clinical result on those patients that you have exposed them to the PEMF device?
Oh, absolutely. The biggest thing is I put it on some of my top athletes, guys that are dealing with pain levels that most of us couldn't even handle in a given day, and within a very short period of time, I was seeing reductions in pain levels and inflammation. They were healing faster, they were recovering faster, and in all my years, I've never been able to achieve that with these athletes this quickly.
How do you see the PEMF therapeutic devices in the field of chiropractic?
Um, Again, it's to me, PEMF is cutting edge technology, and it needs to be out there. It needs to be known. At this point in time, I see PEMF where cold laser was 15, maybe even almost 20 years ago. It wasn't as well known as it should be, but the more of us that are out there, especially in the sports world, that start using it, and the more athletes and patients that are getting results with it, I think it's just going to explode.
So if you mentioned, or if you compared the laser device, can you please elaborate a little bit more about the differences between the PEMF technology, laser, maybe ultrasound, and other devices that you have been using?
Sure. I mean, I've used pretty much every technology that there is through my 18 years, from basic EMS to ultrasound to cold laser, now using PEMF, and the results with the PEMF, again, from pain control, from inflammation control, from cellular healing and recovery. I've never seen anything like it, and in the fact is, we're doing it in a fraction of the time that these other technologies would take us.
Can you please tell me how a pulse electromagnetic field therapy device can bring long-lasting pain relief?
Yeah, absolutely. Well, again, PEMF is doing a number of things. One, it is knocking out pain. Secondly, it's decreasing the inflammation, but the most important and one of the biggest things that it does is it actually starts producing and causing cellular regeneration or healing. And there's very, very few things out there that can actually get tissue to heal faster. And the differences I'm seeing using PEMF compared to any other technology out there right now, it's mind blowing. Like I said, people are just healing faster. I'm getting injuries in athletes recovering faster than anything I thought I ever could. I'm getting athletes that have been dealing with things for years, all of a sudden in 2 weeks going, Doc, the pain's gone. I'm back training harder. I'm back training faster. So, like I said, there's nothing out there right now, in my opinion, that can compare to PEMF.
Thank you. Can you compare PEMF to a TENS device?
Oh, absolutely.
Is it comparable?
It's apples and oranges. I mean, a TENS device, very simply, will cause very, very temporary, short-term decrease in nerve pain, and that's it. If you use a TENS unit, yeah, you may get some temporary, again, pain control. Within an hour or so, it's back. PEMF is actually decreasing not only decreasing pain, because it's taking out the inflammation, because it's causing cellular healing, we're getting long-lasting results, not temporary results.
Okay. And are you familiar with any other PEMF devices on the market?
There are a bunch of different ones. Again, there are big clinical units that are wonderful. The problem is big clinical units are very, very expensive, and they have to stay in the clinic. Patients can't take them home. And the device from Aerotel, again, the beautiful thing, it can go home with the patient. They can travel with it. I go nowhere without one. It's in my briefcase no matter where I travel. So that's the beautiful thing about it.
As a doctor of chiropractic, how popular do you think your patients are with PEMF technology?
PEMF being a newer technology, both patients and the practitioners don't know much about it. There's plenty of research out there, but if you just go online and start just typing in pulsed electromagnetic field or PEMF into a Google search, you're not going to come up with a ton of stuff. It's no different than what cold laser was 15 plus years ago. When it's a new cutting edge technology, it takes time to get things out there, to get the understanding of what it is, how it works, why it's so effective. But as more and more people are using it, as more doctors of chiropractic, physical therapists, medical physicians, especially in the sports and rehabilitation world, start seeing the results and using this technology, we're going to see a huge influx of resource and patients not only using it, but patients going to their medical doctors, their chiropractors, their physical therapists, and saying, "I want this. I don't want that muscle stim. I want pulsed electromagnetic field therapy because it works."